Good morning, and thank you for joining us here on the Morning Medical Update. I'm Jessica Lovell. It is summer, and just like many of you, we are working hard to bring you some fun and exciting shows come fall. This morning, we are bringing you a rebroadcast of one of our favorite shows. If you have any questions, please leave them below. We will answer them during our live broadcasts on Monday, Wednesdays, and Fridays. So sit back and enjoy this Best of Morning Medical Update.
Hey, good morning. This is Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dall Simons Family Studio. Happy to be back with you on this beautiful Wednesday morning. Today, we're going to be talking about all things COVID. You know, this Open Mics with Dr. Stites is supposed to be a little different program. We were supposed to be diving into other kind of topics like cool advances in Alzheimer's disease or in cancer care therapy and the frontier of medicine, but we've had to stay focused on COVID because obviously that is the thing that is weighing on us heavily. Today we have two special guests joining us who have been and seen it all here in our program and here in our health system. In the studio with me are hospitalist Dr. Chris Brown and ICU nurse manager Casey Pickering. These are two great folks. I've been able to work with them for a very long time. We've had them both here before, and they're going to help us visit today about how COVID-19 compares then and now. So let me show you one, I like to call these the heat maps. Here's a heat map. If you look at the first one, this was on July 30th, and this is in the New York Times. You can follow it every day. And the purple sections represent those areas of the country at the highest risk because of the spread of the Delta variant, that is, the rate of community spread, plus the amount of vaccination. So public health way of looking at where are we at the greatest risk in the country. And this was on July the 30th. And if you'd gone back to June, this would have been focused in just around Springfield, Missouri. But on July 30th, all of a sudden you can see it growing in the south central part of the United States, in the southeast, and in a hot spot out west. Now, let's look what it was 2 days ago. Holy cow. Look at the purple now. Look at how fast in a 2.5 week period that Delta variant, plus the low rate of vaccination and the lack of social distancing and masking, have brought so much of this country to its knees, especially in terms of ICU care, because folks are really sick. Here's a couple other statistics we know. We know that the average age of those who are not vaccinated in our hospital, it's 53. We know the average age of those patients here with COVID-19 who are vaccinated is 67. Not only is this much more a pandemic now, especially focused in the unvaccinated, but it's also two different pandemics. Because those who are vaccinated have one set of risks, and those who are unvaccinated and hold the most risk have a different set of risks. We're going to talk a little bit about that today. We're also going to talk about how, in the midst of this dual pandemic right now, those who are vaccinated, what happens to them, and those who are unvaccinated, about how much more risk you have when you're unvaccinated, and the importance of trying to make sure you take care of yourself and your family. Last week, actually Monday, I was on this program. My sister called me from California and said, "You seem really angry. You seem more frustrated." One of the colleagues with who I worked with, one of the nurses and some of the other docs have stopped me and said, that was a different tone. You're usually, kind of positive, upbeat. I'm a Trekkie, and we look for good news. But you just seemed a little darker. And I think there is frustration. I think there is frustration here because, and I said it on Monday, I'll say it again, we are all tired of COVID. But you go look in our nursing staff's eyes, especially on the COVID units, and you're going to see much more than just you're tired of COVID. You're going to see exhaustion. You see a little bit of anger, a little bit of despair, and just a whole lot of, oh my God, what's happening now? And that's because as a nation, we have failed to address this crisis in the way we should, and it is costing people their lives. We're going to start that conversation with Chris and with Casey in just a moment. Hawkeye's dropping his kids off, so we're going to get our count in just a few seconds. I think it's like a first day of school, so that's pretty important as a dad. And so we'll come back to Hawk in just a minute, but let's see if there are reporter questions out there.
Hey, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Hey, I've got a question from one of our producers, actually. We're big on back-to-school coverage here, and they say with the first districts in Kansas back to school for a week now, more starting to go back. How long are you looking as far as a forecast and before we could tell whether or not the Delta variant is spreading in schools? And what are your concerns now that Delta is by far causing the most infections? I think it's something like 99% of infections now in the U.S.
98, 99 in the U.S., and we know that from wastewater testing. I think we're going to know about schools. It'll take about, I'm going to back up a little bit. We used to say with the original variant and the alpha variant, or the original strain and the alpha variant, that it would take 4 to 6 weeks to really see what the event was and how that rippled through. And the reason it takes a little longer is because first of all, the incubation time was longer. It was like 7 to 12 days. And even after you're transmitted, you could incubate for that long, and then, each person would spread it to 2 people. The Delta variant is different. The incubation time is faster. You can often get sick in 1 to 2 days after you've been exposed, and one person may be infecting 5 to 8 people. So we see it happening faster than it did before. Having said that, still, it will take us a good 2 to 4 weeks to see the impact of schools. And what you have to recognize is that's the beginning of the impact, not the end of the impact. Because you think about it, if one kid infects 5 more kids and another kid infects another 5 kids, that can take a while to ripple through. It's not just going to happen, right away. So we'll start seeing upticks from school, I think, in probably 2 to 3 weeks. We'll start to see that impact, and then we'll start seeing an acceleration thereafter, and that acceleration could be exponential. So it's one of the reasons we pushed so hard in the last few weeks to get masks on in schools, because we know that's the best and most effective way at preventing that kind of rapid transmission.
Gotcha. And, we've been following these briefings for a year and a half, and a year and a half ago,
you've been right there.
we were talking about kids in school, and there wasn't a lot of transmission. It seemed like in school, but did things change? And you touched on this a little bit, but did things change? Has the game changed now because of Delta?
Yeah, it has changed. And so a couple things. So first of all, schools had done a really great job around dedensifying, and they had masking in place. And to the detriment of kids psychologically, and we got that. And kids were closed for a while, and then when they went back, they did hybrid. And then not only were they hybrid, they were distanced within schools, and they were masked. So we know there are a lot of psychological ramifications for that, but in fairness, most of the kids were safe. Delta is different. Kids seem to be more resilient to the alpha strain, the Delta variant. We've heard a lot more children being sick. We've seen a lot of young adults coming into our hospital now, and we know that the average age is much younger, especially if you're not vaccinated. And we know that Children's Mercy has continually pushed out that, gosh, folks, you need a mask in schools. And I think they've been on the program recently and talked about the difference because, gosh, there were psychological issues. We do think kids should be back at school, but they have to be masked to stay safe. Because here's all of our fears. The Delta variant is more transmissible. It happens in a shorter period of time. It takes 2 to 4 minutes instead of 8 to 12 minutes of close contact, and one person can infect a lot more people. So what does that mean? That means that the potential for harm to kids in schools is much greater this year than last year, especially because A, most kids are still unvaccinated, B, schools are going to go back full throttle, C, there's not going to be the same degree of distancing, and whatever my next letter is, isn't that E? I don't remember where I was, but the next letter would tell us that it's the lack of masking that will really determine it. So what we're all saying is get as many of those kids vaccinated as you can, those 12 and above, and wear masks. Because otherwise, our fear is that schools will end up having to close again, and we think that's a really bad outcome. So what you have to weigh is that whether or not you're going to take masks off and be in school versus leave masks on and stay in school. And I think that's really the crux of the question, and I think you see that from public health experts around schools all around the country. And so you want kids back, you recognize that they need to be back, they need the social interaction, but they also have to be safe, and we got to keep society safe. And we think that that's the way we would balance those two things.
Thank you.
Other questions?
This is Angie Worcono over at KCTV5. I have a question for you about emergency rooms. I know that you guys can't do diversions, but can you talk a little bit about high volume and what you're seeing in emergency rooms among all the hospitals?
Yeah, so let's talk about, what was our census this morning, Chris?
I think it was 889, I think.
Yeah, 889. So that's a whole lot of people, guys. We're packed, and what happens is that you really technically can't go on diversions. You can try to close for ambulances, but as soon as a couple of hospitals close, and everybody has to be back open again. And then what happens is ambulances arrive, but we didn't suddenly create more rooms. We didn't create more staff. We don't have more doctors. We don't have more beds. We have people waiting on gurneys in the hallways to be seen. And that's where we are. And so we don't like that, right? We don't like that because it doesn't allow us to get to patients, and especially time-sensitive diagnoses like strokes and heart attacks and sepsis. We can't get to you fast enough. And so I think we start to back up, and when we do that, care is delayed. So I'm going to pull in my two experts here because I got an ICU nurse manager who does a great job and knows this world. I got one of the hospitalists that knows this world. Casey, thoughts about this whole thing? What happens when the ER backs up?
Oh, gosh. Everything is delayed. It impacts us throughout the entire health system. I mean, we see that for a variety of reasons. That staff down there, they're incredibly stretched, and they get delays. To your point, patients are waiting on gurneys. My rapid response called Blue Team, we end up going down there. I mean, it's like a snowball effect of the negative implications of too many people, not enough beds, not enough space.
Yeah, it's tough. Unless patients get sicker down there, Chris. You're a hospitalist. I know you must go down there and have to try and help them see some folks.
That's correct. And I think just to kind of piggyback, we were discussing before we kind of went live, I think she mentioned, in regards to kind of what that burden is doing on those COVID units for the nurses now. And I kind of think over like the last 18 months where, now when I walk onto the unit, I mean, the things that we're doing now, they were technically being done in ICU, if you kind of agree sometimes. This what the nurses are expected to do, what we're expected to do. We're allowing ourselves now to do more therapeutics that were once only given in ICU. We're able to do on the floor now. So, I mean, it really just stretches itself out across just the hospital as a whole, from the ED to the ICU to the floors, et cetera. And everybody's stretched thin.
We'll make sure we get one of our ER docs and ER staff down here soon because that's a great discussion. But I think that what's happening is the front lines in the ED are just, they're getting pummeled and they're stretched really thin and people are tired. And the thing that they're so frustrated about is that this is completely avoidable, right? It is completely avoidable. And even though there are breakthrough infections, the people who are coming in the hospital who have been vaccinated are still by far the minority. If you said, 20% of our patients right now with COVID-19 have been vaccinated, well, out of that group, 2 of them were incidental because they were here for another reason, but the others all are just severely chronically ill people whose a little COVID was like another little cold that just pushed them over the edge, and now they're here in the hospital. The COVID vaccine continues to do its job. It continues to work even against the Delta variant, and it continues to prevent severe hospitalization, ICU, and death because 95% of the patients in the ICU are unvaccinated. There is no secret sauce here, folks. The answer is vaccinations keep you from dying, and masking keeps you safe and helps you bend the curve, and it can happen acutely. So it's why we keep saying to the community, what happens is when we get backed up like this, and I think all of Kansas City is backed up like this right now. And the problem is that it's not just the COVID patients who pay that price. Every patient pays that price because you can't get in, you can't be seen in an expedited fashion in the emergency rooms, which is by very definition supposed to be taking care of the emergent problems people have. And so they struggle to do that when it's like this. Other questions?
If I could ask one more question about staffing.
Please.
I think a lot of people are confused because they see the charts and we have fewer patients now than we did with the big peak. And so they're wondering why you're having trouble and you guys are so backed up. Can you address what's different with staffing now than what it was like in January?
Yeah, so first off, the real problem is the overall census. So in the fall of last year, there just weren't as many people in the hospital. First of all, there had been distancing and masking, and so other diseases weren't as active, like RSV and things of that nature. We didn't have as many heart attacks and strokes. We're just full. We're full of all sorts of patients, and I think that's what our struggle is across the city. The second thing is last year we canceled surgeries. We have been reluctant to cancel surgeries because all of us across the healthcare industry have taken our easier surgeries and put them into ambulatory surgery centers so they're not in the hospital anymore. And then what's happened is you're left with people who are sick who need surgeries. I gave the example the other day. One of our plastic surgeons said, well, the case I can delay right now, as we talked about it on Sunday afternoon with our surgical team, with our whole, all of our departmental chairs. And we said, give us the list of people you can cancel. And when the plastics guy said, well, my first patient up, I have this person who's waited for a while. They got a big decubitus ulcer. I need to repair it, but that's the one I'd have to wait because the others are people I can't wait with. So it's like, okay, well, that's a terrible wait. Right? That's really bad for that patient to have to wait longer. So what you have to understand is that our levers that we can pull are much fewer now than they were before. And that's where we are having a hard time, is that we're all full. The second thing is that because we're full, we have fewer beds to begin with. And the third thing is that staffing numbers around the community are harder. And it's harder because people are so burned out. Casey, you've seen that in the nursing staff that you deal with them in the ICU.
Yeah, every day. So it's so frustrating when people don't quite understand the full implications of what this added, and they say, oh, it's only 85 total patients, so that's your huge hospital. That can't be that big of an impact. And to his point, what Dr. Stites talked about with our overall census, but our staffing is so much more challenging right now than it was then, right? People are burning out at different rates right now. People that thought they could kind of see it through with our November, December peak, and I say people, I'm talking predominantly about nursing staff, but I know it's throughout, but they thought, we're in it, and then there was this vaccine, there was this glimmer of hope. They thought there was a light at the end of the tunnel. Turns out that light was a train. And now they're just being pushed to the point that they're like, I thought the end was in sight, and now it feels like the end is not in sight. And the impacts that it has on their life and their well-being here and outside of the health system is too much, that they can't do it anymore.
And I think that, remember in March we were down to 2 acute patients. And Hawkeye, you've made it. How are your kids?
Yeah, they're good. My daughter's first day of 7th grade orientation. So.
Awesome. All right.
It's good.
That's an important place to go be for that, so thank you. So how are our numbers today?
Yeah, well, Hayes has gone up a little bit. They have 14 active infections now and 1 recovery, so they've gone up, quite a bit in the last 24 hours. We here at the hospital, again, some technical problems, so we are only able to present our active infections. We have 54 active infections, 16 in the ICU and 10 on the ventilator. 11 of those active infections are vaccinated. And we should say we did have Amanda Cackler help us with some numbers yesterday.
I gave those numbers.
You did.
Yes, sir.
So I think that's pretty impressive, and I'm sure you already commented on that.
Yeah, 23% are have been vaccinated, but again, different age. Their average age is 67 compared to the 54 or 53 of those who are unvaccinated. So as I said, it's almost 2 different pandemics right now.
That's exactly what it is.
We just have to recognize that. And the people who are most at risk and the ones who are dying are the ones who are unvaccinated. Mm-hmm. So I think one of the struggles for the ICU team, too, is that you're seeing younger people who are on the ventilators for longer periods of time, and that just takes an emotional toll because it doesn't have to be this way.
Yes, 100%. So, people ask, what is different, and that was, I know, a topic of conversation. What's different right now from last year? And medically, clinically, I don't know from taking care of these patients, our treatments and the things that we're doing are all very similar, right? But it's just the way that the virus progresses for them in terms of they're healthier to begin with, so they're able to withstand it a little bit longer. And we're caring for them literally weeks and weeks on end. And the outcome typically is the same regardless.
So I think our struggle is that we have fewer staff. Now, we're still able to staff all our beds here at KU, but I'll tell you what, it's a lot thinner. It's really thin margin about that, and we're not able to staff all the operating rooms, so we've had to slow down our surgeries. We've had a longer time out there. People are tired of COVID, and there's a lot of data reported here, reported nationally, about how many folks have left healthcare. And the thing that's really getting to all of us, it's the nursing staff. That's just when nurses aren't here, nurses do. I mean, let's just be bluntly honest. Physicians, I'm a doc. We tend to parachute in and out of rooms. That's great. But the nurses are there every day. They're at the bedside all the time. They're the heroes here in the hospital, along with our respiratory therapists, our dietitians, everybody. But I'll tell you, the nursing staff is right there all the time. And this has taken a toll, and it's made people question whether or not they're going to stay in that profession. And that is a huge loss for all of us.
Completely agree. They're ground zero.
It is ground zero. Other questions? Okay. Team. We've talked a little bit about this. There are a lot of questions surrounding the Delta variant. Help us understand the difference and what's been going on. In case you just mentioned part of it. Chris, what about from your standpoint as a hospitalist? What's different?
I mean, obviously it's a younger population. A lot of them are unvaccinated. I think that at the end of the day, I mean, COVID is COVID in my eyes. I mean, I've never worked in an outpatient setting, so everybody I see or my colleagues see that she may seize, they're just sick. And I think the ramifications ultimately no different. Obviously, we know the transmissible rate is a little bit easier. It's a lot more virulent from that perspective. But it still causes the same comorbidities, same side effects, and, potentially can lead to death. So, I mean, nothing's changed from that perspective. I'm just not trying to keep going down this Greek alphabet, I think we have what we need. We have the necessary data to suggest mask works, vaccines are safe, and I think that's just what we need to stick with.
Yeah.
And I mean, that's just about as blunt as I can be. I don't want to get into too many politics because, I like to talk to my patients.
We stick to the medical science side.
I like
overwhelming.
to talk to my patients, and and there's a lot of misinformation that are guiding, I think, some good people.
Yeah.
And that's just the honest truth.
That's because they're reading from the International Society of Internet News, ISIS, which is a bad source of information. Hawkeye, what's different?
Yeah, I mean, I echo what Chris said. I think he's spot on. I mean, from the overall, disease state in general, really not much has changed. We know how to protect ourselves. We know that it is various interventions. It's not one silver bullet. We are learning more about the virus itself. Is it more fit? Does it have certain changes to spike that may allow it to infect individual cells a little bit better? We are learning all about the molecular biology and the virology of that. But those interventions that we know work, mainly vaccination, masking, distancing, going outdoors if you can, those are all things that we can do to mitigate those risks and reduce infections and spread. And things are not just as they have been early in the pandemic, although we did do shutdowns and significant restrictions. We know that it is not an all or nothing. You can have these thoughtful decisions and discussions, and there is a gray medium in between. And depending what situation you're in, maybe what those infection dynamics are in your certain geographical region, you can incorporate those things either as a whole or a number of those things to help continue to reduce spread. But I think it does all start with vaccination and then going on down the line. We know that masks work. Just as Chris had said, the disinformation, whether people really don't know and they're spreading things, or there is that conscious effort to spread disinformation. We know and understand masking works, so we know those environments where more of the consistent evidence showing mask works are in those high-risk situations, such as being indoors, large gatherings, poor ventilation, all of those things. But the one thing that we still can stand by, the major factor that we can do, is continue to get vaccinated, just as you had talked about. And we have said before, it is now a pandemic of two populations, and that is the vaccinated versus the unvaccinated.
I think that's it. Casey, as patients have come into the ICU, have you and your team, have you had a lot of them say, gosh, I wish I'd been vaccinated?
Well, that's honestly the majority of the time when they come in, they can no longer talk to us. I wish they could talk to us to tell us. And many of them don't survive to make it off the vent to tell us. So from that standpoint, a lot of them I don't know. I can imagine they probably regret it. I think if they would have the opportunity, they would tell us that. But sometimes we do have folks, and they will tell us that, or their family will tell us that. And it's really not, their family just says, I wish they would have gotten the vaccine. Right now, I'm not sure which is harder, and Dr. Brown talked about this earlier too, is the families that talk about, I wish that they would have, or the families that continue to insist that it's actually not COVID and it's still not real. Both, I think, are equally morally distressing and frustrating, and sad, but.
Right, because you see these guys and your team see these folks, and it has got to be hard when people say, well, they're not dying from COVID. And you're like, oh, yeah, they are. What are you thinking here, people?
I mean, as you go from room to room, it's a different narrative, to be honest. I think that, we do have those individuals, rightfully so, that because of an underlying condition or whatever their treatment therapies are at that particular time may not, be able to get the vaccine. And I think that we also need to realize it's not the COVID they can't get. It's multiple different vaccines based upon where they are from their immunocompromised state. Then there's some that just, for whatever reason, just never got the vaccine. And then you do have some that, are going off or making the decisions off some misinformation and misguidance. And so, so it can be difficult sometimes in trying to have a respectful conversation and trying to answer questions by at the same time not using your own personal feelings involved as well. Trying to provide the best medical guidance that you can do. And I think that's really sometimes can be somewhat difficult, trying to separate the two at this point. Because, we go to school to practice medicine. Things that we do are are evidence-based guideline, driven. And trying to keep that personal, you want to say one thing, but you have to kind of professionally say something else.
Right, you want to say, guys, just stop with the falseness. Yeah. Just stop it.
Yeah.
Stop it. Stop pretending that you're an expert in these areas where you're not an expert. Right. And instead, let the people who do this take care of you. We're trying to take care of you. Yeah. We don't have some political motivation in the hospital, right? We have Republicans and Democrats and unaffiliated and, I don't know what else we got in the hospital. We got a bunch of people. But when we're here, we're not trying to have a political convention. Right. We're just trying to take care of you. Yeah. And what happens is people bring this political agenda in, even when they're really sick and dying, and you're like, guys, check your agenda at the door. Right. This is our job. Right. Let us take care of you. Right. And it's just so hard when these other things interfere, Hawk.
Yeah, I got texted to me a meme today about, a lot of parents can barely help their children with 5th grade math, but yet all of them now are infectious disease experts. So I think that's the thing. And we don't have political points of views or bring that into, when you come in with other pneumonias, when you come in with stroke, with heart attack, we are just here to make you better, improve your quality of life, improve your family's quality of life, and we will continue to do that, and we have done that, and we've shown that through history with medicine in general, and physicians and nurses. We've heard Casey's stories. We know it happens every day on the floor, so we are just here to try and get you better, improve your quality of life, but we also will continue to give you that message of a lot of this stuff can be avoided with the preventive measures that we are talking about, most notably vaccination, masking, distancing, and those types of things.
That's so important. Okay, so last questions. Case, how is your work family? How have they handled this pandemic? What are they doing to maintain their sanity?
Well, our work family is getting smaller, sadly, but that's our thing. We're hurting, and my team is incredible, and we've been doing this kind of off and on, but we have to talk about the 61 staff that have been doing it day on end, the 62 staff, and you look and you talk to them, and it's an entirely different type of exhaustion. It's a different type of tired. It's a different type of weary. I think. To my point of what I was saying earlier, just about how there was hope, and then it was just like, part of that hope for the vaccine was also our hope in humanity, really, about like, we thought the world was behind all of us, like they kind of were at the beginning, and everybody's going to do this, and we're going to get through it, and now it feels like so many people are almost against us. that it's hard to continue to bring your heart to this work every day when it feels like, I mean, the odds are just stacked against us, and it doesn't feel like there's an end in sight. So, I mean, it's hard.
Well said. It is hard. Chris, how about for you?
I just echo her on that one. I mean, I think, obviously they're truly first line. I'm able to sit right here and communicate with y'all because I have that first line on 62 right now, right? But I think for me, again, I got a bunch of good friends when we go back to the office, and I can kind of decompress. My wife is in the field, who's a nurse. So therefore, I mean, so we can kind of, I have various ways I can decompress, and so for me, I think, it's not, and I can decompress to him sometimes, so I have plenty of people I can kind of decompress, and I've kind of built a family within, from a physician standpoint as well as from a nursing standpoint, so we can all just kind of see those struggles and kind of bounce some things off each other and kind of go from there and try to, get all of the, the anger or aggravation out, and then when you're able to present and take care of your patients, you're a professional, if that makes sense.
Yeah. Hawk, what do you do to decompress?
I get outside, walking, running. I think that helps. Certainly talking with my colleagues here, whether it's in the infectious disease division, whether it's talking with Chris. It's doing those types of things. Continuing to enjoy what I can, being with my children, spending time with them. I think that helps a lot.
Yeah, I think that's right. I mean, it's that exercise thing, and being with your keep hold your loved ones really close, and exercise and do things, try and get a little rest and sleep, and try not to turn to a lot of bad habits to get through it. But I think the thing that would give our teams the most hope is if folks would just do the things we know that keeps them safe, and it's why the overwhelming majority of patients in our hospital are unvaccinated. It's why the people in the ICU who are on ventilators are 95% unvaccinated. It's why we keep trying to preach this every single day. We've given a whole lot of shots, and we're set now to give a whole bunch of boosters. People are not dying from the vaccine, folks. They're just not, but they are dying of COVID-19, and they're really going to die of that COVID-19 when it's caused by the Delta variant. Let's see if there are questions out there, Jess.
There are, and I'm going to start with a few that revolve around kids and school, if I may. First of all, Heather wants to know if kids should be double masking.
Good question. I think masking's hard enough. I don't know about double masking, Hawk, especially around kids.
Yeah, I would say there's really no guidance to support that. We know double masking, the main reason why, again, I think it was based off of one study. The CDC changed their guidance a little bit, and really what they pointed out was it was for the fit. So I think if you can get a good fitting mask, whether that's a surgical mask that does fit them appropriately so that it reduces the amount of open space around the openings of those masks, or a well-fitting cotton mask, I really think that's going to be sufficient at this point in time.
Yeah.
Okay, Rebecca says, with breakthroughs happening and kids' cases on the rise, how cautious do you need to be around vaccinated family? I'm making people test before seeing us. She says, I read a story about a group of vaccinated families that went on a vacation, and the majority of the kids ended up with COVID.
That is a great question.
Yeah.
There is no absolutely right answer to this question. I think that it's all about what is your level of risk tolerance and how healthy are the other adults in your group. If you are a younger group or your adults are pretty healthy, then even if they get COVID-19, they're not going to really struggle as long as they have been vaccinated. So I think you can feel pretty confident. I think if you are around some older adults who they're 8 months from their last shot and they have a lot of other health conditions like transplant or kidney failure, et cetera, I think you're going to have to be a little bit more careful. And in that situation, testing may make sense, wearing a mask, trying to be distanced, et cetera, the same things we would have done when we were all living in our bubbles. If we can bring back our bubble talk, then I think you can still stay safe. And we know that we can keep people safe, and we know that even folks in nursing homes, by and large, who are getting COVID-19 now are not coming into the hospital because they've been vaccinated. So it really comes down to that. How overall healthy is your group, I think, and Hawkeye, I'll ask for your thoughts too. How overall healthy is everybody? How long has it been since they've been vaccinated? And how do people behave when they're not inside that bubble?
Yeah, I think that's the real point there. We know the vaccinations continue to provide excellent efficacy for those that are vaccinated against hospitalization, severe disease, and death. Now, there are those patients who have underlying diseases that may predispose them to those other issues. But I think the good thing, even about that Provincetown, that MMWR report out of Massachusetts, majority of those were vaccinated, but they were not really ill. There were very few hospitalizations, very few deaths. So I think in general, this does kind of harken back to a year ago, just like you were talking about, understanding the individual risks of those people involved with that family. And the main reason is because those children 12 and under really can't be vaccinated yet. So I think that's important to understand, and also understanding that children can get it. We have seen a higher proportion of children having to go to the hospital, and we also know that children can spread it as well. So I think understanding the individual risk of that situation and what your family is very important moving forward.
Scott has a good question, and I'm glad he brought it up because I heard it on the news this morning and I thought, what? So he says, what are your thoughts that a local school board is now allowing parents to sign a form to medically exempt their children from wearing a mask at school without seeing an actual medical professional or a psychological professional?
Mm-hmm.
Well, that's not a medical exemption then, right? That's just not, by definition, that's a parental exemption. And what the school board is really saying is that if a parent doesn't want their kids to wear a mask, they can sign a form that says they don't have to wear a mask. But let's be clear, that is not a medical exemption. And I think that's the first thing I'd say. The second thing I'd say is, we're all safe when we keep each other safe. At the end of the day, that's something we have said right from the very beginning of this program in March of 2020. We work together to keep each other safe. It says, we the people of the United States of America, not I the one. And it says, we the people, and it goes on to talk, promote the general welfare, provide for the common defense, secure the blessings of liberty on ourselves and our posterity. And I think the message to that, to me, in this fight against COVID-19, is that we have to work to keep each other safe. And if we can use arbitrary reasons for saying my child doesn't need to be part of that, then okay, but be ready to bear the risks and the consequences of that, because there are. To borrow from Barb Barker's old show, there are truth and there are consequences. Mm-hmm. There are truths and there are consequences for our decisions. And the reality is that not having children masked will spread COVID-19, especially with the Delta variant, Hawk.
Yeah. I mean, I think this continues to be just something that we have continued to see throughout the pandemic. It's a myopia of certain populations, of certain groups, for one reason or another. It is a continued centric thought on that individual. We know that there are medical exemptions for people in general, whether that's pediatrics or adults, who can't wear masks, but those are very few. Unfortunately, there probably are physicians who will write that exemption, even though it doesn't really qualify. But again, I think it just continues to be going back to the point of everybody is now a public health and an infectious disease expert. But we know we have very good data, consistent data, showing that children do not suffer from wearing masks, that children wear masks better. But we also have consistent data showing that increased burden of addiction, whether it's to opioids or alcohol, or increased suicide. Why is that? Because of isolation. What is going to lead us to isolation? It is going to be stopping school, quarantining for 14 days because 8,000 students are out of school, like we have seen happen in Florida. That is going to lead to significant health consequences. Wearing a mask for 6 or 7 hours a day, probably not even straight through, because if you can go outside and be at recess, you don't need a mask. That will keep kids in school. that won't cause medical problems, but really keeping them home, isolated, inability to do in-person learning, that is what is going to lead to the true problems.
Jess, we can't hear you.
Okay, so I've got a question for Casey and Chris. Amy wants to know, what can I do to help nursing and medical staff? How can I help? I'm already vaccinated, so I've done that. But what else can I do to help out, just as a regular person?
Case, what do you think? What can a regular person do to help us? We're all regular people, by the way.
We're humans first and foremost. Great job doing your part with getting the vaccine and masking. You know, I would challenge people. A lot of people know at least somebody, right, in their life who maybe doesn't understand the science, is pushing back, is hesitant, right? I would encourage and challenge people to lean into those uncomfortable conversations. You know, one of my favorite quotes talks about, one person can make a difference and everyone should try. Like, what kind of impact could you have if every individual person had a hard conversation to get one more person vaccinated? Right, and it kind of trickles from there. So honestly, I think that's the most helpful thing you do, is encourage and educate and lean into the hard conversations and see what happens.
I completely agree. I think the hardest conversations sometimes are the conversations that are sometimes trying to reveal truth and to demystify things. And I just think that one thing we've learned over the last 18 months is that COVID loves dissension, divisiveness, and separation, and it can continue to persist. So I think that, thanks again for getting the vaccine, but I think it's just one step at a time. If you can just reach out to one person and that person can continue to reach out and it can just kind of propagate, and then we can kind of pick up vaccination rates, we can continue to mask, et cetera, because everybody is tired of wearing a mask. Nobody likes wearing a mask. I think for us, because we're trained that we wear masks for certain things pre-COVID, it's not as hard. But I promise you, I don't want to wear a mask outside of work, to be honest, but I still do. So I think it just requires you having to have those hard conversations, sometimes being the outcast by wearing a mask when nobody else is wearing a mask. And so those are some of the things you have to kind of do. You have to be a leader. You have to do the things that you speak, and therefore, hopefully all it takes is one person to see that, and then they can continue to do and propagate your work.
Yeah, I think what you just said, I love that. COVID loves dissension, and what else did you say?
I don't even know.
Divisiveness.
Yeah,
That's really good, because COVID does, and COVID shows its love by spreading and getting people sick. Yeah. That's how COVID shows love. Yeah. And so COVID loves dissension, divisiveness, falsehoods, because that just allows it just feeds off of it, and there it goes, and it takes off. Well done.
Larry wants to know, as we get closer to those colder temperatures, do air purifiers help inside as much as open windows? Do they help at all?
Yeah, I think the answer inside is that you have to have a mask on. And the problem with all those things is that the reason being outside works is because air particles that you breathe out are dispersed within the air currents. And there's so many air currents outside. The heat's rising up off the ground. The wind's blowing. You're moving. There's so many things that are happening when you're outside with the dynamic. And you can watch the dispersion just take place when you go outside. Think about it. When you go outside and it's really cold and you take a deep breath, you blow out, and you watch that cold breath, you just watch where it goes, right? Remember that? You could do it on yourself. When you're sitting inside, if we were in that cold freezer like Hawkeye and I were about a year ago, and we went in that freezer and we were just breathing and the air wasn't moving in the freezer, then the cold breath just sits there, and you can watch the particles just sit there. And when they sit there, that means I can breathe in the other person's particles much easier. So all these things, opening up a window, if it's creating more air currents, running a fan, all those things can be helpful, but inside is just hard harder. Air purifiers, I don't think air purifiers have a big role, because by that point, it's kind of come in, it's gone through the purifier and gone back out again. It's already been dispersed by all its activity going through the HVAC system by and large.
Yeah. I mean, I would certainly add to that comment about being outdoors and dispersing in the turbulent air. That is important, because then you are at less risk of inhaling that infectious dose or those infectious droplets. And so if you have less around, you have less of a chance to inhale that. But I certainly, do believe, I don't think anything has been shown, there's no data to support the anything other than good ventilation. We've seen a lot of environmental or air purifying products. I think that, again, there is really no data to suggest that those add any more efficacy against preventing disease than does the pure ventilation amount that is going on in that particular environment.
Yeah, so important. Just time for a couple more.
Okay, Gretchen wants to know, how has Nebraska escaped Delta? Has it?
Well, on that heat map, they just didn't have any public reported data, so that the New York Times had access to it, so they haven't escaped it. And I think if you watch it, especially on the more current one, that's the one from July 30th.
Yeah.
Put that new one up there that has the higher amounts of purple on it, guys. And what you would see is that Nebraska isn't. It's actually escalating pretty rapidly right now. So.
Okay. Kim wants to know,
there's a more current one.
Has the vaccine been approved for cancer patients yet? She's asking for herself.
Well, it was never not approved. It was actually, so the EUA applied for everyone, so cancer patients could get it. I think you may be asking about booster shots, and booster shots for cancer patients getting active chemotherapy. Yes, you should go get a booster shot. I think we've all recognized that, and the FDA is rapidly heading towards recommending booster shots for anybody who's more than 8 months out of their last shot. So I think we're all going to be getting booster shots here in the next few months. There is data out there, it's in a sicker population, it's in an older, more chronically ill population, that the Pfizer vaccine is down to about 54% effectiveness after 8 months, and that's what's making the FDA said, hey, we're going to go ahead and give a booster shot, because we believe that will push it back towards full effectiveness. That's all Delta variant issues. And so I think that's really what the crux of this is all based on. So we're all, I think, going to be getting booster shots the next, that's going to open up pretty soon. We're really prioritizing first transplant patients and those who are chronically critically ill, and that includes cancer chemotherapy patients, and those folks don't have to wait 8 months. They should wait 1 month after their last shot, and then go ahead and get a booster. Once we get through that phase, and really I think that's going to be any day now, we're going to start seeing booster shots being given to those further than 8 months out. Hawkeye.
Yeah, I would say for that additional dosing of the booster for those immunocompromised populations. Now, again, the recommendation is at least 28 days out. I think if you can spread that out further, it's probably going to maybe be more clinically benefit. But most of those patients probably were having their vaccination in March or April anyways, and so they can go ahead and get that. Yeah, and as far as the other, the other boosters go, or the other additional dosing, was talking with one of the people on the ACIP, the Advisory Council on Immunization Practices. They are still waiting for data. They do have other meetings coming up that they will be reviewing all of that stuff. We know that they are data-driven. I'm still skeptical that there is not as much clinical efficacy in protecting against hospitalization, severe disease, and death. But again, I don't have access to all the CDC and the FDA data as well. So I think we are all just waiting to see that, just as we were waiting for the data when the original trials came out about the vaccines. And certainly when we do, and we can take a look at that, we'll certainly report it back to you and make those recommendations. And since we have enough supply here, unfortunately, because not enough people are getting vaccinated, we will be able to offer those vaccines to everybody who wants one.
Dr. Seitz, last question, or do you want me to hold these for Friday?
One more, let's do it.
Okay, so I'll end on a positive note with the vaccine. So Pamela says, I'm a COVID long hauler for 9 months. I've been back and forth about getting the shot, but on Monday she got her first Pfizer shot. I don't know if it was coincidence or the shot, but the next morning my COVID rash was gone. The bumps under my skin are gone. Don't know if you've seen this with other people, but I'm happy no matter what was responsible for it.
Actually, we have seen that with other people, and we're hearing that repeatedly, that once you get the vaccine, your long-haul symptoms get better. It's also pretty clear, I think, that if you've had the vaccine, you tend not to get as much long-haul, and if you do have those longer-term symptoms, they're milder and they recover faster. So there's really great news around vaccination all around. And remember, when we think about whether or not we've done enough testing on vaccination, just remember over a billion shots have been given worldwide. We've given over 100,000. Most new treatment trials with new drugs, most of which have a much higher risk profile than the vaccination, don't have anywhere near that number of patients in them, people, and yet we use them in wide-scale use. And, the new high blood pressure drug, you don't get 100,000 people in a trial. So it's just, it is a little befuddling that people can look at this much information around vaccination and still find fault. And I know we have independence and we have individual autonomy, but let's hope that the ability of COVID to cause us to play splitsies doesn't also continue to have us be overwhelmed by a burden of disease that we just shouldn't be having. Let's just hope for that. Hey, final thoughts. I'm going to start with you, Casey.
Gosh, I have a lot. Do you ever feel like people aren't listening anymore?
Yes.
Yeah, so then it's like, should I share
raised
them
3
or
children.
not? Yeah, well, that too. Final thoughts. This is hard. It's a hard time, and people ask, and to the question that was asked a while ago about what can people do to help support. And I think we all know that we are fighting the evolution of this virus that appears to want to survive at all costs. We, as your medical team, as your frontline folks, we're in it to help people survive at all costs. I think we're struggling with the moral injury that feels like so many general public folks aren't willing to do their part to help us all survive, both literally and figuratively, at all costs in this. So I'm going to go back to I would implore people to, one, do their part, and two, encourage others to do their part to help us all survive this and come out on the other side.
Dr. Brown.
I think 18 months, I probably have a lot of thoughts. But I think I'll just kind of piggyback on what you just said in regards to the split C's, the self-autonomy, this wonderful freedom that we have. But I think that the first point is, I think that what we're missing is, just even from a pure medicine standpoint, even when patients use their own self-autonomy to not take medications, et cetera, that causes complications, is typically related to that patient. I think what people are not realizing is the self-autonomy, this freedom is now becoming selfish and now affecting the masses. And I think that's truly probably one of the biggest issues we're having. And it's allowing, again, this dichotomy of just two different set of thoughts that are continuously driving, COVID. And I think I remember when I first learned the Greek alphabet, I was in college doing some things, and I had to kind of learn along the way. But I'm interested to know, like, how many people really are now learning the Greek alphabet due to COVID. Does that make sense? Mm-hmm. Meaning that its persistence is purely being driven by us not being one community. And I just feel like if we can kind of, at least for this one time, just kind of come together to really just get vaccinated, mask, and we can kind of get ahead of it, if that makes sense.
Yeah, I think it makes great sense for both of you.
There's a lot of people out there that are frustrated that are doing some things, and I think Dr. Hawkinson probably can vouch where they're doing things because we're persistently, like my family, friends, like, hey, keep doing it. Like, when can I stop? I didn't want to do this stuff in the first place, but I'm listening to you. But it's those others who are not doing it that are allowing it to continue to persist. And I think that's probably the point that I'm kind of trying to get to, and what I'm seeing going from patient to patient, day in and day out, and dealing with COVID.
Hawk?
Yeah, I mean, it's definitely that divisiveness, and it's that divisiveness that has increase the surge, and it increased overall communities being overwhelmed and hospitals with their capacity being overwhelmed, but it has also increased that individual who would otherwise be healthy is now in those hospitals. We've especially seen right now those southern states, and Chris and I were just talking yesterday about that. So this division is affecting those individuals as well, and I think the best way that we can start to move out of this, because we would all hope to be able to move out of this, is to continue to promote vaccination and get people vaccinated as soon as possible. In addition to those other issues that we've talked about and those other interventions, masking, distancing, being outdoors, because it is not all or nothing. And if we can do those things thoughtfully, we will stop the individual spread in the communities. We will keep people healthy, and we'll be able to continue to do those things that we want to do, gathering at those events that we want to, or having those family parties that we want to. But it continues to be everybody, just as Dr. Brown said, those individuals, so they aren't affecting the rest of the community.
So then and now. Then could be in the future as well as in the past. One of the things I love about Star Trek is it's an optimistic view, and live long and prosper. My team just showed me the good Vulcan salute there. One of the things about the future is that when Captain Kirk's flying around that Starship Enterprise, they go back to the past. What do you think they'll say when they come back to see this era? From Hamilton, history has its eyes on you. What will the story be? What will be written about us and how we responded? How will people look back, your grandchildren and great-grandchildren, how will they look back upon this time, this generation, and how we were conducting ourselves during this, the greatest challenge we have faced as a world in generations? We're in the midst of the COVID wars, and how we respond and fight back against the COVID wars will be what tells our story. Tomorrow, Jessica is back with another morning medical update. Our good friend Dr. Mario Castro, Vice Chair of Clinical and Translational Research at the KU School of Medicine, joins us with the latest on COVID research to help fight the COVID wars, vaccines and therapies. But we want to leave you with a very special and powerful video from Casey. And Casey, I'm going to have you introduce this, because this is you a while back, then and now. How will history look at us, Casey?
Yeah, that's a good question. So this video is, back in April, I was asked to speak at the COVID ceremony, Remembrance and Healing, when we thought we were on the...
We were healing.
We thought we were healing. Was asked to kind of write some thoughts, and did it from the perspective of what we had been through, thinking that we were, on the rise and coming back up. So my caveat to this video, which this team did an incredible job, but is just that it's changed. There definitely can and should be a part 2, I think, of what I wish I had known, it's just changed. I think we're all changed.
What we wish we had known and what we've learned. We'll see you all tomorrow.
I'm Casey Pickering, the nurse manager of the medical ICU, program manager for the Rapid Response Code Blue program. And people have often asked me, what do you wish you had known when this started? And I think if I took the time to answer the question, it would provide really valuable insight and feedback to folks to better describe the experiences of frontline staff the past year. I wish I had known that on March 7th of 2020, with the admission of our very first COVID ICU patient, as a health system, it was the start of a journey that would inevitably challenge and change us all forever. And 11 days later, when we had to tell every individual visitor they would have to leave only to not return the next day, it was just the beginning of the gut-wrenching conversations that we would have. I wish I would have known that family members and friends would beg and plead for us to not let their loved one die alone, and we would go to extreme measures to keep each and every one of those promises. That these patients would be afraid, but in a much different way than we had ever encountered. That many of them, while hospitalized, were simultaneously watching their fate play out on TV, and it felt like a scene straight out of a movie. I wish I had known that for many, our voices were the last they heard, and we were the last to hear theirs. And all too similarly, it was our hands that would be the very last that they would hold. We would learn the hard way to stop promising patients that they were going to be okay, and we would start promising that we were going to take the absolute very best care of them. I wish I had known that there would be countless sleepless nights due to vivid nightmares around resources, PPE, patients dying, and even our own staff contracting COVID and dying, leaving us with not enough help. And that our PPE, while it protected us, it would leave us bruised and battered, and sometimes even bloody, but it would in fact always protect us. I wish I had known that we'd often spend more time at the hospital than at home, and we would all take the phrase work family to an entirely new level, because for many of us, it was our peers who were the only ones who could possibly understand what it was we were going through. That we would become the integral link between patients and families during their most difficult days, which would be challenging, exhausting, and also incredibly rewarding. I wish I had known that the decompensations would often come quickly, and despite our uncompromising efforts, many of these patients would not survive, leaving us feeling defeated and at times completely devastated. That for many patients, to survive the discharge meant an incredibly long and hard-fought battle. That hope is not a promise, and no one was ever out of the woods. That the losses would be frequent and incredibly heartbreaking, and we would have to cling to the success stories for days on end to help carry us through. I wish I had known that we would all navigate our own personal loss and grief while simultaneously navigating significant loss and grief every day at work, only exacerbating our mental and emotional exhaustion. That shifts would be harder and longer than anything we had ever experienced, and some weeks, every day was a bad day. That we would often leave wondering how could we possibly come back and do it again, and yet we always would come back and do it again. I wish I had known that many patients would be alone, that virtual goodbyes would become the norm rather than the exception, and even those were never guaranteed. I wish I had known that despite the challenges, the grief, the loss, the stress, we would redefine what it means to be resilient, and we would all gain a deeper understanding and appreciation of what it means to show grace. That we would have to find creative and innovative ways to bring our hearts to this work, but we would continue to show up for our patients and families in meaningful ways, providing moments of joy in the midst of the most tragic situations. That there would be laughter and tears, joy and heartache, triumph and defeat. And with all that, there would be immense pride, knowing that someday we will look back on this and we will know that we did our part, and so much more. I wish I had known that while this pandemic would prove to be one of the greatest challenges of our time, we would all rise to the occasion, highlighting the importance of each and every one of our roles, the strengths of our team, and profoundly showing that we are in fact so much better and stronger together.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.
Thank you so much for joining us this morning for this Best of Morning Medical Update. You can catch our live broadcasts every Monday, Wednesday, and Friday. And don't forget, you can always email us at medicalnewsnetwork@kumc.edu or reach out to us on Facebook, Twitter, and YouTube. We will be back to our live shows 5 days a week starting September 6th. So please go out, make it a great day.